More than 3 months since former President Jimmy Carter began home hospice care. It's helping bust the myth that hospice is only for the last days or hours of someone's life. But now hospice care is increasingly being used to help people living with dementia. I spoke to a hospice company here in Atlanta, the first in the metro to go through a specialized dementia simulation training. And they say it's changing the game in the way they provide care.
What percentage of the patients do you work with, would you say, are living with some form of dementia?
60% of ours. It's the #1 diagnosis on our program.
When Capstone Hospice CEO Hugh Henderson first started in the business 30 years ago, he says cancer patients were the majority by far. But as treatments for cancer have gotten better, neurological illnesses have outpaced them, and it's changing the way they need to provide care.
Caring for someone with Alzheimer's dementia is not the same as caring someone with pancreatic cancer.
So Hugh brought in a training group called Educate. It provides a dementia simulation training to help people experience firsthand what it might be like to have dementia. Participants wear headphones that play sounds to simulate the inability to filter out background noise, glasses to simulate the tunnel vision people with dementia often get, and gloves to make it harder to perform fine motor tasks like buttoning a shirt.
Zip the vest and place on a hanger.
And then with all of that, an instructor calls out instructions to follow.
And those 10 minutes are so life-altering. People come out of that experience and they go, I had no idea. Literally, I had no idea.
I was irritated, annoyed, lonely, and foolish because I was given instructions, but I couldn't really hear. I didn't know what to do. That is empathy overload.
And that's exactly the goal, to infuse more patience, compassion, and understanding in the people tasked with taking care of the people who need help.
Did you say I love you, take me home?
Paul Enger's wife, Patricia, has been with Capstone Hospice for 3 years as she lives with late-stage dementia.
Once you understand what this disease is really doing to that person, you're more compassionate, you're more patient, you're more loving, you're more giving.